Department of Health has been keeping a close eye on dengue cases after a case popped up in Haleiwa. Mosquitoes are known to spread the virus. Here to tell us more about what people need to know is Matthew Carano from the Department of Health. Thank you for coming in, Matt. This is an important issue, right?
Yeah, this is a really important issue, and you know, thank you for having me and being able to help communicate and spread the word to the community.
Yeah, because we want everybody to be, you know, up to date on this. No one likes mosquitoes. I mean, they're pesky. They bite you, right? So, what's the risk to people from a mosquito bite?
Well, here's the thing. You know, in Hawaii, not that much of a risk. It's a nuisance. But mosquitoes are the most dangerous animal in the world. More deaths than sharks and alligators and hippos. Yeah. Because they can carry diseases and spread these diseases from person to person. And these diseases, like dengue virus, sadly, can become very severe and take lives.
Yeah, I mean, they're poking their needle into your skin, taking out blood, and then doing the same thing to someone else. So it's like getting somebody else's blood. I mean, that's what they do. So what happened in Haleiwa? What about the dengue virus, and how did this come about?
Yeah, let me explain, because I actually thought, like you, that, you know, it's almost the blood-to-blood type transmission, yeah. But it's a little bit even scarier than that.
Oh, okay.
Somebody comes back from an area around the world. It could be Southeast Asia, South America, Africa, continental US.
Yeah.
They carry the virus, the mosquito bites them, the mosquito actually becomes infected.
Ah.
And for up to 14 days, it can be flying around infecting other people.
Ooh, that's good. That's a long time, 14 days, right?
It is.
So what's the status of it right now?
So the good news right now is we feel fairly confident that we're coming out of the woods. Risk is never zero with public health, as you guys know. But the longer that we stay disease-free, the more confident we feel that the disease has not established itself in Hawaii. And that's what our epidemiologists, our field teams, our laboratories here to do, is protect public health through not letting diseases get entrenched here.
Yeah, that's the thing. If they get entrenched or to get their foot on the ground here in Hawaii. So what can people do to reduce the risk from this?
The biggest thing is try not to get sick when you go to these areas and bring it back, you know. But you know, sometimes, unfortunately, we bring back more than good memories. And
so it's the travel that gets us.
Yeah, Hawaii, you know, is paradise, right? We don't have the diseases. In fact, no native mosquitoes. So when you come back from these areas and you feel sick, go to the doctor, let them know your travel history. If they do, if your doctor thinks that it might be a disease like this, they'll send it to our labs, and then we need to get rid of mosquitoes around our houses. We can just walk around, dump them out. It's the smallest containers, you'd be surprised.
Yeah, I mean, it's not just us, it's people visiting here from all over the world. So yeah, from all corners we're getting, I'd like to see how Hawaii compares to other, you know, areas of how many different people we get all year. So if someone suspects they've been bitten or infected by a mosquito, either at home or abroad, what should they do?
It's not every mosquito bite that'll make you sick, thank goodness. But if you're sick, see your primary care physician. That is always our directive. And you know, you in concert with your doctor, with your healthcare provider, can make the decisions necessary whether we need to test you. And if you do, you know, we have the state laboratories and we have epidemiologists. And like I said, we have wonderful professionals out there that can respond and react to really contain this and help keep you and the population healthy.
So here's when I hear mosquito, I think of this because I'm a big history buff. And, you know, the Panama Canal would never have been built if they didn't get rid of a mosquito problem. So it's very, I mean, this is early 1900s, so a very unsafe construction. You would think people would die more of that, but the thing that was killing the most people down there was the mosquito. So this doctor comes in and says, you got to get rid of mosquitoes or you'll never get it built. And he got all this money to get rid of mosquitoes by going to the ponds and all this. And guess what? It worked.
It works.
So that, I mean, that's, you said that earlier, that it's the most dangerous thing. I've heard that more than once, that mosquitoes are the biggest killer.
It is true, and worldwide, there is more disease and more disease coming to Hawaii, and I hate to put it out there, but climate change is magnifying the risks to our population and travel, and we want people to travel. I love to travel.
Exactly.
But there are the risks out there, and that's why our teams exist, but our teams alone can't do it, right? Public health is everyone's responsibility, and that's why we like to spread the message.
Absolutely. And we're not trying to scare anyone. No. I mean, this is the thing. I mean, you're going to get bit by a mosquito. Not every time you're going to get sick, but if you get symptoms, if you know you get bit by a mosquito, you get some symptoms, start, you know, ask a few questions, maybe look it up on the internet, and then if you have to, come to you guys and tell what's going on.
We always want you to see your primary care physician.
That's true, yeah.
In Hawaii, You get bitten by a mosquito, we are so lucky we do not have those endemic diseases. We don't. And that is why we actually jump into action when somebody does bring it, because you need the disease and you need the way it spreads. You know, we have the way it spreads.
Right.
But we don't have the disease, and we want to keep it that way.
And we want to keep it that way. And awareness is the best way to keep us all safe. Matt, thank you very much.
Thank you so much.
Sure.